Hi there, it's Dr. Grant Pagdin, and I wanted to talk to you a little bit about osteoarthritis. Now, have you been told that you have bone-on-bone osteoarthritis? That sounds pretty terrible, doesn't it? And oftentimes you'll hear that terminology from the orthopedic surgeons indicating to you that really the only option you have is a total joint replacement. Well, you know, we grade osteoarthritis on a scale of 1 to 4 according to the severity. And we typically base that on weight-bearing x-rays if your joint is a weight-bearing joint. So if it's your hip or your knee or your ankle, we like to look at that under load when you're bearing weight on those joints. So grade 0 means the absence of any osteoarthritis on the x-ray. Grade 1 has some mild changes. There's not really any narrowing of the joint, but we start to see some little bone spurs sticking out the side of the joint called osteophytes. So that would be grade 1. Grade 2, the osteophytes are starting to get a little bit more obvious, and there may be the beginnings of some narrowing of the joint space. So the bones are getting a little closer together. There's still some cushioning, but it's starting to get a little bit thin. And grade 3 osteoarthritis, a little bit more advanced osteophytes, and there's definitely some thinning of the articular cartilage, and the space in the joint is significantly diminished. And grade 4 osteoarthritis is really when there's an absence of the articular cartilage. That's when the bones can come into contact with each other, and there can be some grinding of those surfaces. That causes some thickening of the bone on either side of the joint, which is called sclerosis. The bone spurs are quite advanced, and the joint is really quite degenerated at that point. Now, keep in mind that at any of these stages of osteoarthritis, we have a variety of different treatment options on the table. So I had people that come to me with x-rays that I would grade as grade 2 osteoarthritis, and they're being told that their condition is bone on bone and they need surgery. Well, certainly at that point, I would recommend a few other non-surgical options first, starting with something simple, like physiotherapy. Then we have some types of injections that we can do, including things like hyaluronic acid, which is a fairly thick, viscous jelly that we squirt in the joint and it provides some shock absorption. We can use platelets that are taken from your blood. Platelets are even a little bit more effective than hyaluronic acid in providing a healthy environment in the joint and sustaining the joint. And then finally, we also do some regenerative type of injections using stem cells. Now, this is for research purposes, and we are gathering evidence about the way that stem cells can be used to help to extend the life of a joint, and they do have the possibility of helping you to rejuvenate some of your articular cartilage. Now, over the course of the time that I've been doing these types of regenerative injections, I've had the opportunity to treat patients with all different grades of osteoarthritis, all the way up to the most severe grade 4 osteoarthritis. And particularly, this would be elderly patients with multiple medical complications that are not a particularly good candidate for orthopedic surgery. They come to me hoping for some of these options as kind of a last-ditch effort to help to preserve the life of their joint. And many times we can have very successful outcomes, alleviating pain and improving function even in the most severe forms of osteoarthritis. So please give us a call at Pagdin Health if you would like to discuss your options. If you've heard the term bone-on-bone osteoarthritis, that doesn't mean you definitely need a joint replacement.